So, how was your day?
It was fine. How was yours?
Very long, traveling and just getting home, and trying to get settled. You know how that goes.
Yeah, I can't imagine how busy you were.
A lot. It's a lot, but always good.
That's good. Let me see. I
How
think,
are you? Where are you at right now? What rotation and stuff?
well, I'm right now located in Miami.
Oh, okay. Good. 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 Good.
Yeah. So I'm a medical graduate from Bolivia.
Nice.
I don't know why. I'm trying to make her some other, let me see. It's not letting me.
There.
Oh, okay.
Hi, Dr. Sloan. Hi, Sophia.
How are
How are you?
I'm good. How are you? Can you hear me well?
you?
Yes. Yeah.
Okay.
Okay.
Mhm.
So, if you guys ready, we could start.
Yeah.
Okay, well, hello everyone. My name is Sophia Chavarria. I'm one of the members of the communications Instagram subcommittees of the Association of Women Surgeons. I'm a medical graduate from Bolivia. Today I have my colleague Xiamora joining us with the interview. Sonia, can you please introduce yourself? Xiamora?
Yeah.
Hi.
Hi. My name is Xiomara Ortiz. I'm the co-chair with Denise for the Instagram subcommittee. I'm in my fourth year in Ross University School of Medicine, and right now I'm located in Miami as well.
Oh, perfect. Okay, so today we're conducting a Takeover Monday series. So Takeover Monday series consists of having every month a different specialty where we will interview the doctors of that specialty. And today we have orthopedic surgery where we have Dr. Sloan, which is an honor. Sam-
Yeah.
Yes, sorry. So Dr. Sonya Sloan, better known as hashtag Dr. OrthoDoc, has established herself as a force to be reckoned with the male-dominated field of orthopedic surgery. Licensed to practice medicine in several states, she travels the country to extend the impact of her unique approach to patient care, including local tenants and telemedicine, one of the first ventures of its kind. Um, and Dr. Sloan believes in paying it forward which is a direct example of her book, The Roles of Medicine as a Medical Professional's Guides to Success as Amazon bestseller in medical education.
yeah.
Yes, medical education and training. She's the first lady to Dr. Timothy Sloan of the Luke Church and a super mom of her three favorite people, her children. Three.
Three of them.
Uh,
Wow.
Dr. Sloan, do you wanna tell us a little bit about where did you did your MD, where did you do the residency, and where you are right now?
Yeah. So I did my medical school at University of Texas Medical Branch in Galveston, which is the first medical school in Texas. And so our class was like over 150 people by the time we graduated. I think we started with 200. And then I got into Baylor College of Medicine as the first Black female intern in general surgery, and then became the first Black female ortho resident and to graduate as far as residency and orthopedic surgery in the state of Texas. So that was in 2006. Then I practiced went into private practice for a few months, and I was pregnant and decided, I really wanted to do the mommy thing, and then realized that it was just going to take up too much time to be full time. So I figured out this thing called locum tenens, which no one was really doing back in 2006. And I think I started in '07 in Kansas. So I had multiple state licenses in Kansas, Virginia, North Dakota, South Dakota, Colorado, Louisiana, and a few other states. I can't remember other ones that I've worked in. So
Wow.
it allowed me to, and for just a short amount of time, and make very, very good money, and then be mom and be
Right.
church lady and do my nonprofits and my other stuff that I like to do.
And you're also the founder for the National Black Women Physicians Day.
Yes, that was in 2021. We basically, Dr. Siri Press, she's actually outside of Atlanta. had looked at doing Rebecca Crumpler. She was the first Black female doctor in the United States in 1864, and it was a question of why are we not celebrating that? And so she tried to get it started and didn't move fast enough, like in 2020 during COVID. And there was another organization that was just highlighting her throughout the year, whatever else. And then Dr. Kanisha Hall was like, well, I have enough social media and maybe we can push it like as a social media thing. And so it started gaining momentum. And then I am work closely with Congresswoman Lee, Sheila Jackson Lee, on
Yes.
some other things and on our as community development and that kind of thing. And I said, is this even possible? And she says, send me the details and let me see what I can do. And within days, she was able to get a congressional proclamation and recognize February 8th, which is Rebecca Lee Crumpler's date of birth, as our National Black Women's Physicians Day in 2021. And so it still just gives me chills that we're finally celebrating, because as you know, African American female doctors are only 2% of the totality of all doctors in the United States. And so we still got a long way to go. And then people understanding that plight and being able to celebrate at least one day that we have as women surgeons and doctors and internists and everything else it was a great feel. And so it's been a takeover on social media, pretty much on all platforms, at least on that day and several even after that. And we just want to celebrate. It's a celebration of who we are and what we have.
That's amazing and so inspiring. Thank you so much for doing that. That's amazing.
Yeah.
You want to get started?
Yes. So before in the questions, if you guys have any question, please feel free to ask the question in the Q&A box below. So leading to my first question, what inspired you to choose orthopedic surgery?
Yes, I was an athlete. I was cheerleader, like competitive cheerleading. I was in gymnastics for years since I was little. I was on the track and field team. I ran the 100 hurdles and I made it to regionals, and in the state of Texas is a big deal. And on the last hurdle crossing it, I hit my left knee, the back part of my knee, and coming across the hurdle and sublux my kneecap. And so my patella went one way, my leg went the other way. And then had to go to the ER to have it reduced and all this other stuff. And, I was traumatized, and I'd been to an orthopedic before. And I grew up in a small town where I never saw a female doctor. I never saw a Black doctor. It was only white males. And so it was not something I was even thinking about, but my mom was a registered nurse. And so, getting to work with Dr. Black was his name. He was phenomenal. Just, he let me come in on some of the surgeries. And because my mom wasn't, working at the hospital, I was able to observe several things. And he was so kind and basically put the idea in my head of like, we need more women in orthopedic surgery, and athletes are always going to be injured and people are always going to break things. It's a great field to go into. So it started there, was me as an athlete with my own injury. And then when I got to medical school, I just loved it. It was one of the things that just seemed right to me. Like, it's not internal medicine, no disrespect, but I'm not going to heal or cure diabetes or hypertension, in a couple of visits. But someone breaks a bone or dislocates, then I can usually be done with that in like 6-week period of time, maybe 12 weeks. So my patients get better and they go away, if you will, so that was something that I loved. And I love the surgeries. Like, who gets to use drills and saws and hammers
Yeah.
daily procedure? It's like, who does that? Like, and some people freaked out with that, but to me it was super, super cool,
Yeah.
That's awesome. Another question, do you had a mentor to guide you before residency?
I did.
Sorry, go ahead.
Not before residency. You know how you get into medical school and you feel like the medical school is supposed to help you and push you, and they're supposed to have people there, and they did. Don't get me wrong, they did. It's almost like you don't know what you don't know.
Mm.
You don't know what you don't know, and people are not necessarily telling you, i.e. the rules of medicine. It was one of the, I wanted people to know there's a lot out there that no one ever really tells you or says it, but everyone assumes you know or you should know. And so
Yes.
a lot of people didn't say, oh, you need a mentor or you need an advocate. And so let me tell you the difference between a mentor and an advocate. A mentor is someone that's going to say, hey, yeah, you probably should be applying for, your MCAT and doing your essay and trying to get research done or whatever to get into this program. An advocate is someone that, like, once you're there, or even once you get there, before you get there, there's someone that's going to speak on your behalf. They're the more personal person that's going to be like, hey, she's a great person. She's going to work her ass off to do whatever it takes to get it done. I think she's going to be an asset to your program. So that's an advocate. It's someone that speaks on your behalf. A mentor guides you on the path. And both are important. Both are definitely important. But they act in different ways and usually are two different people. So you just have to remember that when you're trying to choose that person, because not everyone has time to mentor, and or they don't know what they're supposed to be mentoring you on. Is the other thing. Versus an advocate, when my people that come to me and they're like, this is what's happening, this is what's going on, can you help me? And it's like, yes. And that's the advocate piece. So I had a mentor and I had an advocate, and Dr. Ronald Lindsay was definitely my mentor to get me through the steps and sort of guide me, whatever else. And then Dr. Bill Bryan was an advocate. Like, this man wrote letters for me. He would speak at committees for me. He would always encourage me, that kind of thing. And then he'd say things like, maybe you should talk to these people, or whatever. So he was a good person. And some of the doctors I ran into really were kind to me. And then I had the not so kind, being a woman in orthopedic surgery.
Mm-hmm. Yeah, I can imagine. So that leads up to my next question. How do you think mentorship and representation impact academic and clinical decisions?
Huge, huge, because the fact that there's not enough of people that look like us to give us direction and understand what we're going through on a daily, the emotional, the psychological, the personal, the stress level, the outside life that a woman has to deal with, different than a man.
Mm-hmm.
Need that female mentor. Not to say male mentors, I only had male mentors up until a certain point, but it took that to know I needed more. So to have that means you have to have those people in place that can be on that level to mentor you. If I'm the first, who's going to mentor me? That kind of thing. And so you don't have it unless we create this avenue where more women are getting into medicine and into surgical fields to be there to help others. I say the pull it up, the pay it forward, let me make sure the door is open so others can come behind me.
Of course, yes. Mm-hmm.
Um, what is, on a different note, what is your favorite part of your specific practice and what makes it unique?
A lot of people, we really do hate clinic, but I actually enjoy clinic. I'm on the Indian reservation, the Navajo Nation Indian reservation in corners in New Mexico, Arizona, Utah, and Colorado. And so Navajo Nation is the largest Indian reservation. So I take care of Navajo, Zuni, Hopi, Akomo, Apache, and a few other tribes that come through that area. So the clinic to me is where I actually get to spend a little bit of time in learning people in a culture that I would never be privy to otherwise. And they are so appreciative. Like, I've, done things in other places, in other countries, and it's just as desolate and underserved as any other place in the world in third world countries. And we're here in America, so it is interesting to be able to spend that time with them. I've learned things. I've learned cultural things. I've learned people that are just the same, but is also very, very different. So it's to treat 1, 2, 3 generations. They may all be living in the same household. So I've taken care of the grandmother that broke the hip, the dad that fell off the ladder, and then the child that was playing basketball and hurt his knee or whatever. I've taken care of whole families. And so that's been an honor. That's a privilege.
Wow, that's actually to the festival, the 50-year annual Navajo, the powwow in over.
Oh,
Yeah,
wow.
yeah, it was amazing.
Amazing people.
Yeah. Um, Leading up to my next question, what experience did you have the best, and what other experiences did you encounter hardships in residency?
Ooh, that's a low question. Okay, so worst encounter, and I'm just gonna be very, very honest. I won't say names. Um, I had one of the staff members who did not believe that I belonged in the residency spot. He thought guys were only supposed to be there. It was my third year, and I was at a specific hospital that didn't tolerate um, the bullying, if you will, the
Mhm.
bullying. I tell people all the time, medicine is a hazing organization that you get into residency and people think, oh, everyone's going to be your friend and everyone's going to sing kumbaya and everyone's going to like you. It's like not so much because everyone's there for a different reason and everyone is competitive. And a lot of times people don't always want you to succeed or be, your best. And you would think faculty would, but nonetheless. Anyway, this one day, the patient's leg was falling off the table, and there was a child. It was a pediatric patient. So I was trying to make sure they didn't break sterility. We didn't break the sterile field. So I grabbed the leg, and then like he took a pair of DeBakey pickups, were very long and very thick, and hit my hand really hard. And so I pulled my hands back, and I'm just like, what just happened? Like, was I just assaulted? Like, did this guy just hit me? So I had the split decision. Like, we're talking milliseconds of one was to start crying because I had been humiliated. Two,
Mhm.
knock the hell out of him because he had hit me. And then three was to finish the case and then deal with the ramifications afterwards. Well, the anesthesiologist was a woman and she was livid. And so she stopped the case and she had called upstairs to the powers to be and had started this process. So by the time I walked out of the operating room, I was, could not cry. It was one of those, you can't cry because that shows weakness for a woman, right?
Mm-hmm.
My tears were not because I was weak. My tears were because I was angry as hell and I wanted to hit him, but I could not because I knew in that split second, if I did, I would not have finished. And I was 2 years away from finishing. And that no other Black woman, and maybe not another woman, would ever come behind me.
Mhm.
In my wisdom, it was a split second decision to honor those that I knew I was trying to open the door for, not just for me personally, And so that was hard. Now, he got in a little trouble. He got a little slap on the hand, no pun intended, after he had hit me on the hand. And nothing really happened to him though. He stayed. But you document everything, document, CYA, Rule 22, So in doing that, Baylor couldn't say or do anything to me, their ortho department, because they knew it was a huge lawsuit. Uh,
Mhm.
one of those, leave her alone. She's endured a lot already, and she hasn't retaliated. It was fine. The rest of the 2 years was okay. There was a couple other incidents that were smaller, but for the most part, I knew what I was dealing with. And it wasn't everyone. Like I said, I had some great mentors and advocates.
Mhm.
Had a few bad apples that made it really, really hard for women in ortho at that time because the mentality is such you don't women weren't allowed.
Mhm.
But still today, women only make up 6% of orthopedic
Yes.
surgery, and Black women 1%. There's only like 100 of us in the country.
Mhm.
That's a very,
Actually,
very brave decision for you to make at that time. Like, no, I'm not gonna let this incident stop me from becoming my true self
Correct.
and letting others behind me get there. That's amazing. Thank you so much for that.
yes.
Um,
And it's some side of that, some of the best situations have been some of the same doctors that actually, like I said, advocating. And one, we're actually still very good friends. He actually treated my daughter here in Houston, and it was a patient that was sort of out of control and needed some type of medical care and was somewhat abusive and had sort of grabbed me. It's like at our level one trauma center, stuff. And you sort of know that how things are because it's always crazy or whatever else. But this guy like went down and sort of like told the guy, he defended me, basically, very gentleman would or whatever else. And you do not put your hands on a woman, you do not da da da. And he was talking to the patient, and the patient apologized or whatever else. But I had men like that as well that I work with that stood up for me. So that's what I appreciated. Yeah.
That's good. And the good one, I think we said the hardships, and what are the best experience in residency?
The patient always hilarious. I mean, I have some of the best stories from patients and treating patients. Some of the craziest situations, some of the things I would never have thought would have happened. Um, Being honored to right now working the past 5, almost 6 years on the Navajo Nation, being able to be part of that culture because they don't let everyone in. So that's been an honor as well for me. And then definitely the surgeries. I enjoy surgery. I love going into the operating room. I love my surgical team. We're like a family, It's like there's some bonds that people don't understand. I talk about it in my book about the medical humor. People don't get medical humor. Like unless you're in surgery or you're in medicine, there's some things that we say that outsiders would be like, what? But it's else. And so I love that life for us. Yeah.
Mm-hmm.
Right. And on that same note, what barriers or challenges did you encounter as a woman and as a Black female doctor, female surgeon?
I didn't know that I was first. When I went into ortho, I thought that there was a whole bunch. I had no idea. I didn't know the statistics. I didn't know that there's not other Black women. There were like 2 Black men there, and there had been one that had graduated before me, but that wasn't on my radar. My whole thought was like, I'm gonna be an orthopod. It's like this is finally gonna happen. And so it wasn't until later that I understood that the mentality of how women are perceived in the field, the the jokes, the harassment, the entitlement, not by everyone, but overall, it becomes almost that barrier of like either you're one of the guys or you're not, and so you cannot be not a team player, but at the same time, if you don't jive culturally, you don't mesh with them personally, if you don't try to include yourself in things that they're all doing together, playing, going to the bar, whatever, you know, it can become harder on you to be part of that training ground. And so those are some hardships that people don't always teach you. And again, that's why I wrote the book mainly, was because I wish someone would have told me, get your ass up and go play golf with them at 6 in the morning on Saturdays, even if they didn't invite you, because that's when they were talking about decisions about other jobs or financial investments or who could connect you with certain people and networking and stuff like that. It wasn't necessarily always in the operating room, so learning to play the game, the politics of that. So no one ever told me not to trust anyone. And I say that lightly, but that's rule number one. And again, it goes back to people are competitive. And so therefore, just because you think you're on a team and you think everyone's your friend, and women specifically, we want to be friends with everyone. We want to be people pleasers or whatever else. But that's not always the case. And these guys are going for it. They're gunners. They're going to get their asses in the operating room. They're going to show you up as soon as they, because that's their life. That's them making a name for themselves, and that's money. So don't take it personal. Just don't trust anyone. But also because your patients' lives depend on it. They depend on you to look at the x-rays and you to get the labs and that kind of stuff. And, I mean, there's people in medicine, yeah, you do trust that are friends or whatever else that become friends. But when you're being competitive, just remember, trust no one.
Yeah.
Wow.
That leads me to my next question. Why do you think there's still a struggle in diversity in orthopedic surgery?
Who controls the power? In our society, and let's be very frank and what it is, white men have always controlled the narrative when it came to physician. Women physicians really didn't come on board until like later on, and or even those medical colleges or whatever else were limited to the number of women that came there. You don't think they got harassed as well? And so now the narrative's changed. We have more women into medicine than we have ever before, right? But we're like at 51, 52%. But academically, who's controlling the door to get those women in? Who has the narrative of who passes, fails, gets through certain rotations when surgical fields are still predominantly male dominated, you know? So it's about power and control, and the fact that we have not breached that in a way that's going to make numbers palliatively change the next decade. I always say it takes, 15 years to make a surgeon, right? You got 4 years of college, you got 4 years of medical school, you got 4 years of residency or five. So you're already at like around a 10, 11, 12 years. If you add a year of research or fellowship on there, you're at like a 14-year period. So if it takes 14 years to make one surgeon, and most of us are so tired and spent, we just want to get out, make some money, and then have a life. We want to have our all these other things. So therefore, they don't go back into academic medicine, and they're not there to open the door and be at the table when decisions are made.
I agree.
Completely.
I totally.
Which leads us to my next question. How do you think we as women can overcome this gender bias?
We have to definitely speak up. You have to, my husband would say, you got to stand up and say something, and it's a matter of us having that united voice. And I'm a part of an organization of women in orthopedics. Someone says 15 years of no years up. But Black women orthopedic surgeons have just come together, and so with our voice united, it's a visibility thing. It's also, we're a different generation because we're all over social media. That was not before. So that whole nother audience of influence and power statements that some parties that be don't want that. So even with the 6% of women, we talk about this whole thing of speak up ortho, hashtag speak up ortho, and it's about all of the crazy shit we've had to go through, all of the people that have touched us, hit us, tried to assault us, who have sexually harassed us, all of that. And so we come out with these statements and say it. And there's a TikTok on it that we've talked about, the men actually have to read the script. So it wasn't until we became socially on a political and social platform that they were willing to face themselves because they had to, right? So when women come together, women physicians, women doctors, surgeons, whatever else, and we speak up and we finally stand up, that's when things begin to change. Because also the narrative is, you're not going to let us, we're going to demand it. You can either sit back and take it, or you can push and demand, and that's where we are.
Yes.
And not just the people that are actively like being aggressive, but the bystanders as well, because you can be around and not say anything, and you're part of the problem,
right?
Because you're not saying.
It's the gang mentality. It's the gang mentality of like, well, if they're all doing it, if all these other men are doing it, and therefore I'm not going to advocate for you, I'm not going to stand up for you, because then they're pushed to the side and pushed out, right? So called the boys club, right? And if it's the boys and you're again so hard trying to knock down the door to get in, it is very, very hard. Yeah. Speaking against the fear will actually cause negative effect and retaliation. You are so right. The retaliation is you may not make it. And that's what I was saying earlier when that guy basically hit me, assaulted me. I had a split decision that if I did retaliate, if I hit him, then hell, I was going to be arrested. If I started crying, then I was going to look like what they call, oh, you're a baby, or you're a bitch, whatever. But if I didn't, and I had to remember, play the game. You got to play the game. Remember, you're there to learn something, learn a trade, a practice, a skill set that you can't get any other place. And if it takes you 5 years to do that, to play the game so you can get out and you can make $500,000, then do it, as well as create the narrative that other women can come behind you. And that was my split decision to do that at that time. You have to create that narrative for them.
Yes.
Open the door.
Open the door. Open the door. Pay it forward. Yep.
That's why I like these organizations, because they give women, the power, and just everyone could relate, like the only one going through this.
And that's the other thing, is that you don't realize you feel like you're on an island, isolated. And even until 2020, when we were going through the whole George Floyd thing and everything else, it was really about being psychologically just tortured as Black women surgeons and having to go into the operating room and not say anything,
Mm-hmm.
talking shit and saying things, whatever else. And so we all started having almost like texting each other and coming together, and it became a group of us and more of us and more. And then we realized we've all gone through this and we've never connected. And now it's like mental has helped all of us so much. And we, enjoy, it's almost a different type of sisterhood.
Yeah, true. Well, that leads me to my another question. What inspired you to be an entrepreneur and an author of the bestseller book, The Rules of Medicine?
So I have two things. So I was, when I got out of college, I went to Texas Tech undergrad, chemistry major, and I got waitlisted at Rush in Chicago to go into medical. And so I called myself being angry at God. I would not advise that. Don't be mad at God. It's like you just things happen, right? And I think everything happens for a reason. And so
Yeah.
I got waitlisted. I went home for the summer, and during the summer, I met a friend of a friend that was actually my cousin's best friend, and we sort of knew each other growing up, but did not know each other. Well, he was going off to Princeton, up in New Jersey for theology school, and so we fell in love over the summer. And I and started saying, well, I'm just going to take a job up at Johnson & Johnson in the chemistry lab up there. So I came home to explain that to my parents, who did not receive it very well. And well, I was like, I said, can we go to a coffee house and just sit and talk? Because at that time, every place in Princeton and Philadelphia and New York, there were these beautiful coffee houses. You can go and sit and have a cup of coffee and, and just hang out for the day and study and read and whatever else. And I love that. And we didn't have that in Texas so much. So Starbucks had just started hitting Texas. So this was 1994. And I came home, my parents were like, well, we don't have a coffee house. And there's Austin College and Grayson County College there. So you had this university type of town and no coffee houses. So IHOP, and then there was Kettle, and then they had some other little breakfast place that had coffee, but they were done at 10 a.m. So I borrowed $50,000. I learned to write a lesson plan. I went and consulted with people that did have coffee houses in the Dallas area that would talk to me. And I opened my first coffee house in December 3rd in 1994, called Not Just Coffee. And I had it for about 2 years, and then sold it to my parents. And then I think they sold it, maybe a year later, because of medical school. And so I became an entrepreneur and didn't even realize I had the entrepreneurial spirit. And it was like, if I see a need or I see a way that you can make some money, I tend to gravitate towards that. The other side was I started some nonprofits. I've had a couple of nonprofits. I have one now, it's called SLOAN STEM, which is SLOAN STEM+Arts, helping minority kids get into STEM fields. Because as we know, if you go into a science, technology, engineering, math, a medicine field, you're guaranteed a six-figure salary usually, which means that sustainability financially for not just that person, but also their families and generations to come. So it's trying to help that, so exposing these kids earlier. And then the rules of medicine, again, my book was because no one told me. I was devastated and humiliated, and it was hard as hell, and no one had said these things. Now, some of the things are you already know. It's like see one, do one, teach one. We've all heard it, but we don't really understand why that's that case. It's like because you're not trained enough to do a heart surgery yet. You got to see one, you got to do a whole bunch, and then you can teach someone else, because now you're an expert. About the politics of medicine, about the money of medicine, about self-care in medicine, about time management, about leadership, all these different things that are small but major that you don't learn because you're so focused on just learning anatomy, physiology, pathology, learning how to do an ankle fracture, learning how to do a hip fracture, whatever else. You don't see all the other little things that should be who you are and what you're doing.
Yeah, that's true.
And speaking of your book, you also wrote in 2019 something called "It's Okay to Cry."
Yep.
Can you talk about that?
Yeah.
A little bit.
Yeah, that was a hard one. I got pregnant during residency, which you're not supposed to get pregnant during residency, and I was was having a miscarriage.
Mm.
And because I was an all-boy team, I really couldn't talk about it. But I was going through one of the times in my life, and I had no one to talk to about it. And I remember the nurse after I had a miscarriage, and so that's a whole nother topic now about having an abortion, right? Like, so therefore I had to have this DNC to go in to have the miscarriage removed. And afterwards, I had the best nurse that was at the hospital I was working at the time in the PACU in the
Mm.
post area. And so she says, okay, stop being the doctor and be the patient. And it's okay to cry. Okay to cry. And then the other incidents, I was in trauma. I was in trauma, level 1 trauma, and it was a horrible car accident, truck, 18-wheeler, and no one had really survived. And they brought the patient in only enough to get him to the hospital where he finally succumbed and passed. And so no one had told the parents that, and they had driven across the country. I'm sorry, across the state, which was Texas from El Paso to Houston, is like almost 12 hours. And so they get there. No one knew who he was because he was considered unknown, patient unknown, number 614 or whatever. And I was in the ICU, and we realized what had happened. And so I had to break the news to them. It was one of the first families I had to tell that their son had passed away. And so they were a very large Hispanic family. And in their culture, that mother, and as any mother would, wanted to see her child.
Mm-hmm.
Considered a crime scene, we were not able to touch the body and take out things that had been done to the body. So therefore, even though he had been cleaned up, there was still a tube, and there were still IVs, and there was still a chest tube there. You know what I mean? Like, there were still things like that until the pathologists had done their part. So it took the mom, the dad, and the brother. And the brother was probably a teenager, down to the morgue in the bottom of the hospital, and um, the family followed. And when I say a big family, we're talking like 20 following us.
Wow.
And the halls were made of cinder block, that thick concrete type block, but porous enough that you could hear. So when the pathologist said, they pulled out the tray, and the priest was there with us, the hospital chaplain, and the hospital chaplain standing next to me, and I'm standing there. And I'm a very religious person, spiritual person. And when I tell you that that mom climbed into the drawer with that child and held him, I mean, I couldn't hold back. And I remember feeling a tap at the small of my back. And the chaplain says, it's okay to cry. You got to be human.
Wow.
And she's like, this was the time to be human. And so the dad had turned his back because he couldn't see his son like that. And the brother was trying to hold the mom, and the brother starts sobbing. So with that, the people in the hallways could hear, and the wails that went out because they could feel her pain. I mean, I 20 years
Oh.
later, it
I
hits
bet.
because I'm a it. I
Wow.
get it. So that is the time that you say, it's okay to be human. It's okay to cry. And a lot of medical professionals need to know that and feel that, because we cut it off. We compartmentalize, and we choose not to sometimes because we think we have to be tough, and we have to be able to draw the line. But sometimes what people need is to see that you're human too.
More human.
Exactly.
And
Yeah.
not just that. Sometimes I feel like in medicine, if you don't separate your emotions at that particular time, it's a very hard time, a very hard thing to witness. I can imagine if you don't separate your humanity from your work, it seems like unprofessional.
Yeah,
And
exactly.
I really like what you wrote about it's okay to cry. And after witnessing that scene, how do you think that has affect or that has changed the way you approach your patients from that moment on?
I think everyone needs a therapist. We go through so much psychological and emotional trauma, that we hold it. And like you said, we compartmentalize and we don't process it. And so we need a way to release it. You
Mm-hmm.
need to call it the self-care. That means that's, yes, you, like me, for if that's religious, if that's praying, if that's church, if that's going out for a run, if that's meditating, if that's a getaway when you can, can I talk through it? sometimes. I need to be able to express my feelings and emotion and be okay with that. That's where we are, that we don't have, at this point in society, we have so many medical doctors that are committing suicide, and the burnout that are leaving medicine, and specifically COVID's a whole nother monster that we have not even dealt with the ramifications
Mhm.
of the that we have as medical professionals have had to endure working through a pandemic. I mean, I know I really haven't, and so therefore now it's almost laughable when people talk about COVID. I'm still thinking of the first time we were prepping for the first patient to come in that had COVID that I know and I watched that died. And now I hear people say, "Oh, you got a cough and you have COVID," and we've softened it so people can, it's palatable to people, but it's still not, it's not something we have as medical professionals have processed properly. Therapists and have those people that you can talk to. Yeah.
Yes, I totally agree because, like I said, we're all human, and we have to be vulnerable sometimes, even to have that patient-physician relationship. So.
Considered a weakness sometimes in medicine,
Hmm.
but I use it to be an extraordinary strength if you know how to will it.
Of course, yeah.
Yeah. And even like helps you connect with your, I think it helps you connect with your patient like in another level, because they're not just a number to you, and they know they're not a number to you,
Hmm.
and that you actually care. Because it's very important to have especially a physician, when you're coming with doubts or when you're coming with a pain, that you know that your physician actually cares and it's listening and it's involved.
Yeah.
Yes, and it's human.
And
As
especially in surgery too, because surgeries, like surgeons, they think they have to be tough, they have to be strong, you know, and you're not allowed to show emotion. And that's another thing too, that it shows different vulnerability.
Yes, we've covered almost all the questions. But
as a female wanting to go into ortho, okay, one, get the book. Okay, Maury 16, get the book, The Rules of Medicine. It's going to sort of help you sort of guide the path. Um, I also say in going into ortho, you have to have allies. You also need that we were talking about earlier as an advocate. So get in a program that you know has women and minorities in it. Don't go to a program that has never had a woman and never had a minority person in it. Those tend to not be as friendly to help you get through it. You want to maybe have some research if you can. That'll help just give you a step up if you can. And if not, that's okay. You want to be able to visit a residency program that may help you. So that's during your medical school year, third year, fourth year, where you can do your away rotations, your AIs, that you can go to the facilities that may uh, allow you to see if that's someplace you could possibly be and want to be. But other than that, as a woman in orthopedics, you do have to toughen up in the sense of you cannot not necessarily just be the flowers and rainbows and butterflies. One of the best books I've ever written or read was given to me by one of my advocates, and it's called, the book is called Hardball for Women. I was looking for it on my shelf. I don't see it. Hardball for Women by Pat Heim. And in that book, Pat Heim talks about um, when you look at two different male and female and boys, when boys are little, boys are taught one thing, girls are taught another. Girls are taught, oh, pink is your color. It's soft, it's nice. You're supposed to play nicely with everyone. You're supposed to speak softly. You're supposed to cross your legs and you're supposed to, sit properly. We're supposed to wear dresses. You're supposed to play nice and have teeth, right? And then boys are taught, go get the ball, suck it up. Blue is their color, so heart is a primary color. Don't cry. And so those two dichotomies grow up from elementary, middle school, high school to college to C-suite operating room scenarios. And what are girls doing? We are still playing nicely. We're talking softly. We don't play ball. We don't go get the ball. You understand? And
Yeah.
and not everyone's that way. Competitive sports and done some other things, and we have parents that have taught us differently or whatever else, and we've learned to speak up and use our voice. But that mentality creates that imposter syndrome that sometimes is there. Is like, I can't do that. I'm not supposed to do that. You know, Sheryl Sandberg's book, Lean In, C-suite sitting at the table, be there, be present, be part of it. Make them feel you, make them recognize you, and be part of the conversations. So be
Great
unapologetic.
advice.
And on that note, Dr. Sloan, what are some tips for family planning as a resident? I know you say you didn't recommend that, but now that you went through it, what would you say to a younger self?
My younger self, I would definitely say, don't think you can do it all. I tell people I do some speaking and I say, you can't have it all. You can have it all, but that means you got to have a crew, a village. You got to have people that you can trust that can be there to help take care of the family. You got to learn to delegate. That means if you can't cook, then find somebody else that can cook. If you feel like your spouse or significant other or not your single parent, whatever else, then you hire the nanny, you hire the housekeeper, you hire people that can, or friends or family that can be there to support you. And if you don't have the money to do those things, then you've got to figure out a way to share the responsibility. In residency, we would, the woman kids, we actually would babysit each other's kids sometimes, whatever. So it's that understanding that you can have it all, but it comes in seasons and at different times, and it comes with a tribe of people that will help you. And if not, be willing to pay for the freaking help. I mean, it don't have to be the shero every time. Shero is checked out. Get someone.
Yeah.
You're only human.
Um,
Um,
I wanted to ask this last question, because I feel like it's very inspiring and amazing, that you opened a clinic in Haiti, and because I too work in a nonprofit organization, a clinic for the impoverished and uninsured population over here in Miami, in South Florida. So I was interested, like, what made you move forward with this mission?
We were part of it's called New Missions organization, and they're actually out of Orlando. It's a Christian-based organization in Haiti in the Legon Plateau that they basically have churches that also function as schools. And so we got into it to help with the food and shoes and that kind of thing. So when we were there visiting, I think on the second time we were there visiting, the campus where they house us, during our stay there, and we're right on the water, no less. I was walking and realized we were on uneven ground. And I said, what is this? It was like the remains of the medical clinic after the earthquake, and so they
Wow.
never fixed it. And so when they took me to the makeshift medical clinic, it brought me to tears. And there's footage of it, your video of like it was a curtain table, like one of the 6-foot tables. It was like half broken down, very dilapidated, dusty. They had medical equipment and medical supplies that were just thrown in the box and had water damage or whatever else, but they were using that stuff. You know, people had shipped it or sent it or whatever else, but it never really been taken care of, or they were just desperate for whatever they can get. And
Mhm.
I mean, it was like no one deserves to live like that, and nor the help that people think that America is sending doesn't really get sent.
Yeah.
Okay. You have the medical missions that show up with cameras and smiling and taking the selfies and the pictures, to be able to post, and they really don't do anything. And so our church, the Luke Church, we're here in North Houston, $75,000, and we built a medical clinic, almost 3,000 square feet for that facility and for that organization, and it serves almost 100,000 people on that population
wow.
over a year's time. There's a lot of prenatal care. A lot of trauma, basic trauma stuff. It's not a surgical suite or whatever else. They can do some minor stuff. They have 3 nurses and they have a PA, and they function and they run, and they have the World Health Organization that comes in and they do a lot of the immunizations. But we were fresh well water that was on their grounds, on their property, that goes to it. And we have electricity to it. So it was just phenomenal going back to see it. And we opened it right as Hurricane Matthew hit, which was a Cat 5 that hit Haiti and like devastated. And so we were able to supply more stuff to them. So we haven't been back. since COVID hit, and a lot of the political unrest that's there, but we still send money and supplies. They are able to function and work well there. So it's one of those, if you have more, you're obligated to do more, and if you have the resources and or the people that you can reach out to make things happen, then you should be doing that.
That's true.
That's very
Yeah. I
thank you
think
so.
hmm
Go ahead. Sorry.
no, I was saying I think it's super important. It's like if you have to give out to the community, especially the people that need.
Yeah. And I mean, and again, supporting other organizations that may be on the ground already doing it. And there are a lot that are already doing it. I'm not telling everyone you got to go and build your own medical clinic or whatever else, because it's not easy and it's not hard and you got to have some inside structure. But if that is part of the World Health Organization or Red Cross or other people that are on the ground, then, support those.
Mm-hmm.
Right.
Yeah.
Thank you so much for that. That's truly amazing. I have a question here on what advice would you give to a high school student who's interested in becoming a surgeon? I think we already went through it, but if you want to add something more. High school, yeah.
Specifically for orthopedics, Perry Initiative is an organization that the Black Women Orthopedic Surgeon has teamed up with. They're a phenomenal organization. They're probably one of the only organizations that advocates for women specifically to be more proactive earlier. So they start at middle school, high school, and then some college as well. And so they give them, these are women they're pushing to go into orthopedics. And so they have bioskill labs, they have sawbones where they're actually getting to drill and do that kind of stuff. They travel all over the country. They train them understanding the type of fracture and why you would do counterpoints of screw fixation stuff. So they make it logical and fun to them. So it makes more women, girls, whatever, want to go into orthopedics. So is one I would look into. And then there's other organizations, including the American Medical Association, that has other teen programs, high school programs that may push you in a different field. And that may be everything from anesthesia. I see one of my anesthesia buddies on there. As well as internal medicine, peds, or whatever else. And so you need to find organizations that are specifically high school, college, that have programs and allyship that can help you on your journey.
Mm-hmm. Yeah.
Awesome. Thank you so much. I have one last question if we still have time. Can you speak on how you've been an advocate for yourself as a Black woman in surgery?
Well, this is a good question. Miami Holmes, it says advice for people who have imposter syndrome and think that they're too broke to apply for medical school. So the imposter syndrome is one that we were talking about earlier. It's like where you've been beat down so much that people don't advocate for yourself because you feel like you're not worthy to be at the table. The whole Sheryl Sandberg lean in, can I be present and still speak for myself and succeed? So I'm not gonna lie, the things are stacked against you, but you do have more going for you. If you can get at least to the door, to open the door, to get in the door, you're more likely to get out the door. So when I talk to people about imposter syndrome, we all have it. I don't care, you're going to be in the room with some brilliant people that may have skills different than you, but everyone brings something different to the table when it comes to medicine. And that's why it's an art form, but it's also why medicine has diversified with more women, more minority women, that kind of thing. And so I would say use that imposter syndrome energy to push forward and keep going. And then when you say broke, I say broke meaning money wise, take out the loans or whatever else. It's sort of a delayed gratification of can I pay it back later on. And so yeah, we're at a different time right now when it comes to money and medical school, and there's places in the country that are now not even charging people to go to medical school. Oh, I'm like, what the hell? I'm like, where was this when I was going to medical school? So you just never know. And I'm definitely a believer in prayer and that things will open up and ways will happen that you never knew if it's meant to be. The other side of that is that people would say, well, I don't have 12, 14 years to go in. The 4 years of medical school, 4 years of residency, 4 years of college, plus fellowship and all this other stuff. Again, 12, 14 years, right? Something like a PA degree, a nurse practitioner degree, where you basically come out and you're still the boss. You're practicing medicine, and your malpractice is less than mine, as well as your hours and your life, quality of life, are so much better. So if it's really about having MD on your name, then that's one that you may say, get over that and look at what you're really going after. If it's really to help people, there's so many other avenues. And then I personally am a huge advocate of saying business side of medicine is a monster right now. So if you really want to be on the other side, there's two things. One is business side of medicine, hospital administration. I mean, hell, they're making six figures like us, and they're doing half the work in a third of the time. What? So think about that. Hospital administration, business degree, master's degree, come out, and you're still in the hospital. You may not be, sewing up, legs and whatever else, but you're still making decisions that are basically about patients' care. And then the other thing is anything to do with medical technology, AI, robotics, VR, those things like that, crypto, anything that's going to be like blockchain stuff. Those are terms that in the medical industry we are still so behind, but are dollar makers going forward. So that's what I would tell people to look at.
Yeah. So true. Okay. Well, I feel like I could talk to you for hours, going like different conversations. You're very fun. You're a phenomenal woman and person. It was amazing talking to you and had the honor to interview you. Excellent advice also, like they said. Please.
Yeah. I'm
Well,
looking to see if there's like any other last question, but I don't see anything else.
We hit it all.
Yes.
My only advice, my last would be, if you're in medicine, and I don't care if it's nursing, PA, physician, whatever else, you're obligated to come back and pay it forward. You're obligated to go back and encourage someone else that looks like you, to show them the path and how to do it and to make it more successful for them. So be that person. The Rule 34 and the Rules of Medicine in my book is pay it forward. Someone helped you, so you got to help somebody else.
Mm-hmm. Yes.
Completely.
Well,
Thank you so
thank you.
much, Sloan. Thank you so much. Thank you everyone for being here, for all your questions. Thank you so much again, Dr. Sloan, for all your advice, for taking this time to be with us. We hope to see you again soon.
Yeah.
Appreciate it. Thank you for having me.
Thank
Thank
you.
you.
Have
Thank
a good
you.
night, everyone.
Bye.
Thank you for joining us.
Bye.
Bye-bye.
Bye.